Bismillahirrahmanirrahim. Okay, now we move on to some different sort of section. That is the most common section. I will upload a different section afterwards. This is the first section with 7 slides and 27 points, I guess. So you can read them in PDF form or in slide mode and can listen to this video as well. These are the most important MCQs from CPSP past questions. So the first one is the most common genetic cause of intellectual disability, that is Down syndrome, trisomy 21. And the second most common cause is Fragile X syndrome, that is a trinucleotide repeat expansion. So two tries, the first one is trisomy 21, that is the Down syndrome. The other is Fragile X syndrome. The mostly asked question is Down syndrome. And the most common cause of Down syndrome is trisomy 21, another MCQ. So these are paired together so you don't forget them. Then the most common inborn error of metabolism is PKU, phenylketonuria. It is more than galactosemia, so you have to keep in mind whenever there is only galactosemia and not PKU given, then you have to choose galactosemia. Otherwise PKU is always preferred one. The fourth point is most common immunodeficiency is a selective IgA deficiency. So that is the genetic cause. That is selective IgA. Otherwise, the most common acquired cause of immune deficiency is HIV or AIDS. So these two most common are paired together as well. Moving on to next slide. Most common cells in islets of Langerhans are beta cells, the insulin producing cells, because that is the major endocrine hormone. And the most common exocrine pancreatic carcinoma is ductal adenocarcinoma. Why ductal? Because exocrine secretions are secreted through ducts and versus endocrine which are directly into blood. So one MCQ of endocrinal system and one of exocrinal, you have to keep in mind. That's why they are paired here. Most common site of gastric ulcer is antrum of stomach, that is the terminal part. We have not to confuse the fundus with the antrum. Fundus is the starting point towards the esophagus and antrum is towards the duodenum, and that is the most common site of gastric ulcers. And then the most common cause of gastric outlet obstruction overall and in children, it is hypertrophic pyloric stenosis, HPS. They give a history of smoking as well as genetic history for HPS, but you have to remember that it is projectile vomiting in the scenario, and non-bilous because bile pigments are secreted and salts are secreted inside the second part of duodenum where ampulla of Vater is there. So if there is a gastric outlet obstruction, so all the stomach contents will be in the vomitus. It is a non-bilous projectile vomiting, and history of smoking and genetic history of same given, then it is HPS, hypertrophic pyloric stenosis. It is the overall most common cause in the children, and in adults it is peptic ulcer disease induced stricture, one of the complications of PUD. And in elderly it is gastric carcinoma. In elderly, most of the scenarios are of carcinoma, as also seen in colorectal cancer. Bleeding, most common cause is colorectal cancer in old age, and in gastric obstruction or outlet obstruction, it is the gastric carcinoma if old age is given. So these all are paired together so you don't confuse them. The next slide. Most common cause of liver cirrhosis in Pakistan is hepatitis C. You have seen in clinics that most of the cases of cirrhosis are coming with hepatitis C. You do not have to confuse it with another MCQ, that is the most common cause of liver cirrhosis in adults worldwide, that is alcoholism, because of its frequent usage outside Muslim countries, and that forms the major population as well of cirrhosis. So alcoholic cirrhosis is the most common overall, and if asked specifically about Pakistan or asked about which hepatitis or which virus causes, then it is hepatitis C for cirrhosis. And most common cause of NAFLD, non-alcoholic fatty liver disease, in developing countries is obesity. It is also called steatosis instead of NAFLD, and non-alcoholic disease. And the most common cause of steatosis is obesity, and that you have to keep in mind in developing countries. And the MCQ is also only asked of developing countries. The most common acute viral hepatitis is HAV. So AVH is the most common cause of AVH is HAV, just sequence is changed. You have to remember most common clinical scenarios all coming up with hepatitis A infection. Even we don't test them because we know it's hepatitis A. And even in pregnant women, it is the hepatitis A always, unless there is specific scenario of complication and visit of some remote village and epidemics, then it is hepatitis E. Otherwise, overall most common is still hepatitis A. You have to keep in mind. Then most dangerous hepatitis in pregnancy is hepatitis C, and most severe form of chronic hepatitis is HDV, hepatitis D. It is mostly seen as co or super infection with HPV, and chronic severe is seen in HDV. Most common chronic is seen with HCV, and most dangerous in pregnancy is hepatitis E. All are MCQs asked in different ways. Now, moving on to some other related MCQs. Most common hepatitis virus causing carrier state is hepatitis C. So, C for carrier, C for chronicity. Carrier is also by hepatitis C. That carrier state can lead to further cirrhosis as well. So, C for carrier, C for cirrhosis. Most common chronic viral hepatitis in world is hepatitis B. So here is a trick that overall world has more hepatitis B cases than hepatitis C. In our country it is hepatitis C, but worldwide it is hepatitis B. But overall worldwide cause of cirrhosis is alcoholism, and overall Pakistan it is hepatitis C. So all are mixing things, but you have to keep them separate if asked about Pakistan or worldwide. Then most common chronic hepatitis in Pakistan is hepatitis C. We have seen many scenarios in our own experience that most cirrhotic patients have hepatitis C, and most chronic hepatitis patient have hepatitis C, and carrier state is by hepatitis C. Uh, Again, point 8 is explaining it previously. Most commonly associated virus with epidemics is hepatitis E. E for epidemic, E for hepatitis E, and that is the same virus for pregnant female. That is severe cause of hepatitis, and severe chronic cause of hepatitis would be hepatitis D, that we read previously. Then most common route of spread of hepatitis B is sexually in low prevalence areas. It is specifically asked about low prevalence area, it is sexually. Then virus having significant perinatal transmission is again hepatitis B. It is from the fluids and it is sexually transmitted as well. And but hepatitis C MCQ comes with the blood transfusion. So the most common and lethal, sometimes it is most common asked, otherwise it's most lethal asked. Organism spread by blood transfusion is the cytomegalovirus. That is a controversial because people think that most commonly transmitted by blood is hepatitis C or hepatitis B. That's not the case because we do screening for hepatitis viruses, and we don't do screening for cytomegaloviruses. So that is the most common cause of transmission of virus if any given, and also the most lethal one is also cytomegalovirus, not B or C. Most common hepatitis virus spread by blood transfusion. Now if they specifically asked about which hepatitis virus is spread by blood transfusion, so it is hepatitis C. That is mostly seen in clinical scenarios, that most patients have hepatitis C, and that is transmitted by blood transfusion. We have seen cases of uh, spreading because of unhygienic conditions at uh, different locations like dentistry department, hair cutting previously. So they spread hepatitis C a lot in our country. So it is the most common hepatitis virus. But if they ask about most common virus overall, that is cytomegalovirus because of not screening blood products for them, and that is also most lethal. Then most prolonged incubation period of hepatitis is hepatitis B. We have to keep in mind it is the incubation period, not the latency period that comes after acute infection symptoms, and then virus or some viruses go into latency, and some bacteria like syphilis. So most prolonged incubation period of hepatitis is specifically hepatitis B, even more than Epstein-Barr virus and HIV. And the MCQ about HIV asked is HIV has a long latent period, and we have to not confuse it with incubation period. So if incubation period is asked and hepatitis with HIV is given, then we have to choose hepatitis B because it is overall the longest. And if latency period is asked, it is HIV that is latent for many years. And then now moving on to some glands. Most common cause of salivary gland atrophy is by stones. The mechanism involved is apoptosis, that is asked separately in an MCQ. And most commonly affected salivary gland by stone is submandibular salivary gland. That we have to keep in mind. Two MCQs related area, that most common cause of salivary gland atrophy is stone, and mostly the stone is seen in this salivary gland is submandibular salivary gland. And but now coming on to tumors, the most common salivary gland tumor is pleomorphic adenoma, that is a benign tumor, and that is mostly present in parotid. P for parotid, P for pleomorphic adenoma, and that is the most common cause of unilateral parotid swelling as well, and overall most common cause of carcinoma as well. Cancer, not carcinoma, because carcinomas are malignant one. So here it is the tumor, just tumor. Benign is more pleomorphic adenoma. And then the most of salivary gland tumors are of parotid. As discussed, the most common cause of unilateral parotid swelling is pleomorphic adenoma, and that is the most common primary tumor of salivary gland. So P for parotid, P for pleomorphic, and the most common for stone is submandibular. Hope these slides make some concepts clear about different most related most commons they often confuse. Thank you.